here are a few different ways to implement this exercise. Start off with the lightest band. Sit right at the edge, chest up. Make sure your knees and your feet are even. Keep your chest up. Just gonna kind of pump, right? Pulse. Here, 12 to 15 reps. Boom. Second one is if you lean forward, then you do it again. 12 to 15 reps. And then third one is where I'm gonna kind of have the upper part of my back on the edge of the couch. I'm gonna use that to thrust all the way up. And then I'm gonna do the same thing while keeping my hips up. So right now I'm opening my knees. I'll move the camera so you can see. Here, holding and opening, okay? So there's, again, 3 different variations. One with your chest up. And if you notice, if you bring your chest up, your pelvis tilts forward, right? So that's one of the reasons why I like this one. It controls the position of your pelvis. When you slouch back down, your pelvis posteriorly rotates, right? That's why you do it again. And then when you do it with your back on the edge and your hips up, you're doing it with 2 different glute muscles. The glute max to hold your hips up, and then the glute med to abduct the knees. So do those, give it a try. I just attached the band to a doorknob, right? And all you need to do is grab it to where there's a little tension. You're gonna take it, and you're just gonna bring it in front of you and hold. And what you should feel, if you rotate this way, this glute is gonna press and hold this hip down. You're just gonna hold 15 seconds, okay? You're gonna do the same thing either side, 15 seconds. Here it is in another angle. So I'm just wrapping this around my doorknob, holding it here, holding it here. Try not to rotate your hips. Just keep everything as stiff as you can. You're gonna bring it away from you and hold, and try to hold this position. And what you are going to feel is your glute and oblique work in conjunction, because that's going to be a really important part of this exercise that I really, really like, okay? So you can do holds, or you can do reps where you kind of bring it out, hold, bring it out, and hold, okay?